How many calories or kilocalories is one supposed to consume? So for women, it's 1,200 to 1,500 kilocalories per day. For men, it's 1,500 to 1,800 kilocalories per day. Now, there's quite a few diets that we're going to discuss when it comes to weight loss. So the first diet we'll start with are meal replacements. So think about protein bars. They're usually around 200 calories, and you have up to 20 grams of protein, around 5 grams of sugar or less, and then around 5 grams of fiber. Now, these meal replacements actually work pretty well. The more meals you replace the meal bars with, the greater the weight loss. So for example, 2 meal replacements will actually lead to a greater weight loss than just 1 meal replacement. Now, the idea is that if you are going to incorporate these into your diet, you want to reduce your snack consumption and limit your nighttime eating. And that 1 meal or 2 meals that you do eat have to be consisting of wholesome and non-processed foods. And you want to limit the calories from 800 to 100 or 800 to 1,000 kilocalories. Now, after meal replacements, we also have intermittent fasting, which is receiving a lot of press. So the way intermittent fasting works is that the emphasis is on when to eat, the timing of eating, rather than what you eat. So in the 16/8 intermittent fasting technique, you're fasting for 16 hours and then you're eating for 8. During the time that you're able to eat, you're limiting your kilocalorie intake. You want to limit 500 to 600 kilocalories, no more than 1,000. And during the time that you are fasting, you can drink beverages, but they must not contain any sugar, artificial sweeteners, and it's best to avoid dairy products to really make that fasting effective. Now, with intermittent fasting, that's a 16/8. There's also the 5/2, where of 7 days of the work week or 7 days of the week, 5 of those days you're eating your wholesome, unprocessed foods. You're limiting your kilocalorie intake per day. And then 2 of those days, you are actually fasting, which means you do get to eat, but you're limiting your food intake to 500 to 600 kilocalories per day. And then there's the every other day fasting, which has also shown some promise. Outside of intermittent fasting, we have a few other dietary plans. Think about the Mediterranean diet. That's primarily a plant-based diet. So think of fruits, vegetables, legumes, beans, nuts, your heart-healthy oils like extra virgin. And the emphasis is on omega-3 fatty acids. Poultry can also be a part of that. There is a less emphasis on dairy products. You try to limit your dairy products. You try to limit your red meat intake as well. And you do not introduce alcohol if you're not drinking it before you decide to pursue the Mediterranean diet. Then there's also the DASH diet, which is the dietary approach to stopping hypertension. That's also primarily plant-based. And you can't eat meats, but the meats that are recommended are your lean meats, like your poultry, and then your omega-3 fatty acids and fish. Now, the salt intake for the DASH is 2,300 milligrams per day. Now, if you have hypertension though, and you have other medical conditions such as chronic kidney disease, coronary artery disease, hyperlipidemia, stroke, diabetes, then you may need to take much less salt per day. And be careful about adding tabletop salt. Now, we also have the vegetarian diets, which are quite a few. We have the ketogenic diet. In the ketogenic diet, there's an emphasis on fats over carbs to try to fool the body into burning fat, to prioritize fat metabolism over carbohydrate metabolism. And over a period of time, the carbohydrate intake can gradually increase. Now, we as physicians like and prefer dietary approaches before thinking about other things like medicines for weight loss. And dietary approaches have to be in combination with exercise changes. The recommendation is to exercise 150 minutes per week, or almost 30 minutes every weekday. And the exercise has to be moderate intensity. Working on the job, walking, being physically active doesn't count as moderate intensity. Physical activity does count to overall health and can contribute to the wellness overall, but when it comes to moderate intensity, you have to engage in that for really a greater additive effect. Ultimately, which diet you choose will depend on a variety of factors that work best for you. Talk with your doctor about a dietary approach that actually works for you, and until next time.